Concurrent and discriminative validity of the CPT3 and the WRAML2 in the assessment of ADHD by Rebecca Bosley, Regan Chalk, Jenna Hennessy, and Mark McGowan. Attention is a complex process that is required for higher level functioning. Because of its multifaceted nature, it is considered best practice to use both indirect and direct measures when assessing for attentional problems, such as those that are present in ADHD. Notably, literature on the construct of attention has focused on examining the diagnostic accuracy of indirect measures. Research has been conducted on how direct attention batteries, using well-known measures like the CPT3 and WRAML2, contribute to discriminating between clinical and non-clinical presentations of ADHD. However, the findings in regard to the diagnostic accuracy of these measures of attention have mixed findings. The purpose of the present study was to examine the concurrent and discriminant validity of the CPT3 and WRAML2. For research question 1, the concurrent validity between the CPT3 and WRAML2 was examined as a preliminary analysis. To do this, a Pearson's product moment correlational analysis was conducted. For research question 2, the diagnostic accuracy of the CPT3 and WRAML2 when used in conjunction was examined. In order to do this, a discriminant analysis was conducted. The sample consisted of 62 students aged 11 to 13 that were receiving Tier 2 instruction within a response to intervention framework for academic deficits in math or reading. Out of the 62 students, 9 had a prior diagnosis of ADHD. This study utilized data from another study which examined the efficacy of CogMed working memory training. The data were extracted from the pre-intervention phase of the study, during which participants were given the CPT3 and the WRAML2 before receiving the CogMed intervention. A preliminary analysis was conducted to determine which variables were most closely related. Select measures from each instrument were then chosen. Omissions, commissions, and detectability scores were used from the CPT3, and scores from the finger windows and number letter subtests of the WRAML2 were used.
For the first research question, results of the Pearson's product moment correlational analysis of the CPT3 and the WRAML2 indicate that there were 3 values significant at the 0.001 level. Each of these significant values load only onto the CPT3. Specifically, these correlations are between detectability and omissions, which is positively correlated at a high degree, detectability and commissions, which is positively correlated at a high degree, and omissions and commissions, which is positively correlated at a moderate degree. For the second research question, the results from the discriminant analysis showed that the CPT3 and the WRAML2 were able to appropriately identify 85.5% of cases when used together. 98.1% of non-ADHD members in the sample were correctly identified, and only 11.1% of ADHD members were accurately identified. It is best practice to use a multi-method approach when assessing ADHD. There were mixed findings regarding how well direct attention cross-assessment batteries of measures like the CPT3 and the WRAML2 are able to differentiate between ADHD and non-ADHD members, hence the focus of the present study. Findings indicate that there is low concurrent validity amongst the CPT3 and the WRAML2. Results showed that the only significant correlations were amongst the CPT3 omissions, commissions, and detectability. It was also shown that this cross-assessment battery did not accurately identify students who were previously diagnosed with ADHD, but was able to accurately identify most of the participants who were not diagnosed with ADHD. It is important to note that this study did not come without its limitations. The sample that was utilized was very small, consisting of only 9 members who met criteria for a pre-existing diagnosis of ADHD. These members were identified through utilization of parent reports. It is also important to understand that the sample was homogeneous, which might impact the ability to generalize the results of this study. This includes the participants being very similar in academic performance in reading and math, specifically being involved in Tier 2 instruction through a response to intervention tiered system. Results seem to point toward the CPT3 and the WRAML2 measuring different aspects of attention. These instruments collectively may yield a false negative result. It is important when conducting further research to continue to assess the utility of these direct assessment batteries by utilizing a larger and more diverse sample. Consistent with best practice, it is still warranted to utilize a multi-method, multi-dimensional approach for assessing ADHD. Future research should continue to look at the diagnostic accuracy of direct attention measures, including the CPT3 and the WRAML2. Below, you will find contact information for each of the presenters on this study.